name is Milind Dhond. I'm a cardiologist with NorthBay Cardiovascular Medicine Group. On a daily basis, I have a practice where I do 50% in the clinic and 50% in the hospital. I see patients in the clinic, do stress tests and various other tests there. And then in the hospital, I do hospital rounds, we see the patients, and then we read the studies that are done in the hospital and then do procedures in the hospital. I think my patients would say I'm fairly relaxed, I'm easy to talk to. I try to avoid jargon in general so that the patients know exactly what they come across. For instance, like when I'm explaining a test like an echocardiogram, which is an ultrasound to a patient, I'll sometimes describe it in terms of a car. So I'll say, we're going to switch the car on and make sure the engine works okay, give the engine a once over and make sure it's fine. Now, if I was explaining a stress test where we put them on a treadmill, I would say we're going to switch the car on and we're going to drive it at 60 miles an hour and see if it does okay. And to me, I am like the heart mechanic. The thing that I find exciting in cardiology is when you see patients, you're almost like a medical detective. They come to you with a symptom and you have to try and figure out exactly what's going on with that symptom and what is the underlying abnormality in their heart or other part of their body. And usually that involves taking a detailed history from them, doing an exam, and then deciding what tests are going to help you come to the underlying diagnosis. And then once you've figured out the diagnosis, you have to decide if there's a way of fixing their underlying problem. And so that entails a very broad spectrum of knowledge and testing, which we're trained to do, and I like using the full spectrum of my knowledge.